All right, bye, Betty.
Hello everyone, it gives me great pleasure to welcome you to today's event. We're engaging young people with diverse genders, sexualities and sex characteristics in health and health research. My name's Jessie, I use the pronouns she, her, they, them. I'm a Y Commissioner from NH-MRC Wellbeing Health and Youth Centre of Research Excellence in Adolescent Health. The Y Commission is made up of diverse young people aged 12 to 24. We are passionate about youth health and health research. Us Y Commissioners are trained in health research, ethics, methods and translation, and we work with centre investigators to guide, design and undertake research to champion the teenage decade and advance youth health. I will be emceeing this event alongside Mon Shafter, Walkley Award-winning journalist and content lead for ABC Queer. Many of you will know Mon from ABC's podcast Innies and Outies and their current role as the co-chair of the board of 2010. We will begin today's proceedings with a welcome to country from Aboriginal students at Western Sydney University.
My name's Matilda Harry.
And I'm Luke Hodge, and we are both proud Aboriginal staff and students here at Western Sydney University. Together, we would like to acknowledge the sovereign custodians upon the lands of which our campuses stand.
We acknowledge the elders, past, present and emerging, of the Darug, Eora, Dharawal and Wiradjuri nations, and we would like to thank them all for allowing us to continue our business and education on their lands. Western Sydney University is committed to Indigenous excellence and knowledges, as we aim to promote a strong network of Aboriginal and Torres Strait Islander staff, students, alumni, researchers and elders. We would also further like to extend our respects to any Aboriginal and Torres Strait Islander prospective students and guests with us today.
Beautiful. Thank you, Jessie, for that lovely intro earlier, and thanks also so much to the students of Western Sydney Uni for that wonderful welcome to country. I too would like to acknowledge the traditional owners of the lands that we're all on here today. I'm here in Maroubra, Sydney, on Gadigal and Bidjigal land. Would like to pay my respects to elders past, present and emerging, and extend that to the elders of the lands on which you're all on as well. My name's Mon Shafter. My pronouns are they and them. As Jessie said, I'm the content lead of ABC Queer, and I'm very, very stoked and honoured to be your co-host for today's event. And I'm sure I'm going to learn a whole lot hearing from all you experts and young people with so much life experience to bring to this conversation as well. Welcome to our esteemed guests, and thank you to all of you, including the many young people who joined us today for this important discussion. This event has been led and created by the Y Commissioners and has been supported by Y researchers and staff. And it's the direct outcome of young people's partnership with researchers at the Y Centre of Research Excellence. It's been many months in the making, and it's a direct response to Y Commissioner calls for health research and services to engage better with young people with diverse genders, sexualities, and sex characteristics. We're here today to learn about why we need research to better engage with these young people and to discuss what's working and what we need to do to improve. Today, we're going to begin with a poll to get us thinking about how we engage with young people of diverse genders, sexualities and variations in sex characteristics in research. Then we're going to have a facilitated panel discussion with researchers and young people who have lived experience or are an ally, followed by a Q&A today. Feel free to send your questions via the Q&A function, which is probably at the bottom of your screen. bottom right of your screen, and we'll be feeding these into the panel through the event. So I've got a screen over here to my left, and if any of your questions come through, they're going to pop up here, and I can sort of bring them into the conversation at the appropriate moment. So feel free to ask some questions. This session is going to be recorded, and we may share it on our website via social media. Our event hashtag is Research with Pride. So feel free to tweet or comment on social media about the event and the conversation that's happening. Back to you, Jessie.
Thanks, Mon. I'd also like to begin today by acknowledging the traditional custodians of the lands on which we meet today. I'd like to pay my respects to the people from Wiradjuri country, the country on which I meet you all from today. I'd also like to extend my respects to the elders past, present and emerging, and I hope we have quite an informative session. I would now like to introduce all of our panelists for tonight. We have Professor Rachel Skinner. Her pronouns are she, her. She's a pediatrician specialising in adolescent and young adult medicine. She is a Deputy Director of Wellbeing, Health and Youth, an NHMRC Centre of Research Excellence. She is also Senior Clinical Advisor in Youth Health and Wellbeing at New South Wales Ministry of Health. We also have Kristen Davies, she, her pronouns. She is a Research Fellow in the Specialty of Child and Adolescent Health at the University of Sydney. She is a researcher in the Wellbeing, Health and Youth NHMRC Centre of Research Excellence. Kristen is also an ambassador for 2010, co-chair of the Human Rights Council of Australia, co-convener of the Child and Youth Health Special Interest Group for the Public Health Association of Australia, and co-chair of the Research Committee of the Australian Professional Association for Trans Health. We have two special guests, Steph Lum, they, them pronouns, who is an intersex advocate, poet and lawyer based on Ngunnawal land, also known as Canberra. Steph is the founder and editor-in-chief of Youth and I, and Intersex Youth Anthology. And the second person we have as a special guest is Olivia Stewart, she, her pronouns. She is a HSC student, trans activist. We have also Y Commissioner Sahib Kaur, she, her, a high school student passionate about advocating for women's rights and the LGBTQIA+ community in Adelaide, South Australia. And Emily Williams, she, they pronouns, who is a social worker in homelessness, a Master of Arts student in gender studies, full-time advocate in youth empowerment, mental health and feminism on unceded Kaurna land. Okay, so to begin with the event, I'd like to introduce Y Commissioner Safina Lee to get us thinking about engaging young people with diverse gender, sexuality and sex characteristics in health and health research.
Thank you, Jessie. Hi, everyone. My pronouns are she, her, and I'm joining tonight from Ghana country. So to kick off the event, let's think about the following. Please remember that this is a safe and judgment-free space, so please do select an option from the poll that is true to you. All right, I think we'll start now with question 1A. How comfortable are you in ensuring your research includes sexuality diverse young people in your research or consultations? Now, you'll see here that the rating is from a scale of 1 to 3, 1 being not very comfortable to 3 being very comfortable or not applicable. I do not do research or consultations. We'll give you about 10 seconds for everyone to lock their answer in. All right, everyone, let's see the results. Okay, so we've got the majority of people selecting 3, very comfortable, and we've got a split of that of about 15 to 32 people, so about 47% selecting that. Okay, now what about this next question? just a moment, we'll get the question up.
Were you surprised by the results of the first question, Safina?
I think it's very reassuring, really. And, you know, it's fine to be honest. This is the reason that we have webinars like this, you know, to get comfortable with recognizing where you're at and what you can do. All right, thank you. We've got question 1B now. How comfortable are you engaging young people who are trans or non-binary in your research and consultations? Like before, 1 is not very comfortable, 3 is very comfortable. All right, let's see the results for this poll question. Okay, we've got 53% selecting very comfortable and about 10% of people who selected that they don't do research or consultations. Okay, and lastly, with the last question that we have here, and before we dive into it, this question relates to people with variations of sex characteristics. Steph, for our audience members who may not be familiar with that terminology, would you mind explaining what it means?
Thanks, Safina. It is helpful to clarify. What we mean by variations in sex characteristics are bodies that have innate sex characteristics that are different from what we consider typical for male or female bodies. And when we talk about intersex people, we mean people who are born with variations in sex characteristics. So intersex is distinct from LGBT in that it refers to the body, to physical characteristics, and not to gender or sexuality.
Thanks, Steph. All right, so this question, as everyone can see here, is how comfortable are you engaging young people with variations in sex characteristics in your research or consultations? All right, I hope everyone's had a chance to vote now. We'll have a look at the results. Okay, I can see here, this is a bit different to the other questions that we've got. I'm really glad everyone's, you know, having a think and looking at that. So you've got about 33% of people selecting somewhat comfortable, 37% selecting very comfortable, and 20% selecting that they don't do research or consultation. Okay, thank you for participating in the polls. Now, everyone, I hope we can share some insights on why these questions matter to the health and well-being of LGBTQIA+ young people, and how we can meaningfully engage with young people with diverse genders, sexualities, and variations in sex characteristics when it comes to health and medical research. I'll pass back to Jessie and Mon to kick off the conversation with the WH&Y researchers, our special guests, and young people.
Thanks, Safina. Now it's time for our amazing panel. Let's welcome our panelists. Over to you, Mon.
Wonderful. Thanks so much for that. Steph, if it's all right with you, can we go to you first? I was interested in the results of the poll, just said that only 37% of participants were very comfortable engaging with people with variations in sex characteristics, which shows there's a bit of, you know, work to do there, work to improve. The question to you is, why is it important to engage young people with diverse genders, sexualities, and variations of sex characteristics in research and consultation?
Thanks, Fawn. Well, firstly, thanks for having me here. I'm delighted to be invited to participate on this panel. In response to this question, I mean, you know, any research on any population group needs to centre the voices of those involved in order to understand what the needs of the community are. You know, is the research question the one you should even be asking? And to ensure the research is conducted in a way that is appropriate and empowers those who are involved. And this approach will also assist with the validity of your research. And by that, I mean community legitimacy. And really community-based participatory research is the approach favoured by the intersex movement. And specifically in relation to intersex people, you know, for so long, medical interventions have been undertaken on young intersex people, often without their personal consent, often because it's assumed that's what's best for us, that it's better to look normal, that it's too shameful otherwise. But without actually asking intersex people what they want or need, how do we know what they want? How do we know what treatment success looks like? What is a successful surgery, especially if the person never wanted it in the first place and we don't conduct research on treatment outcomes, be it physical, psychological or social outcomes. So we need to engage young intersex people in research about their own bodies and lives in order to better understand what issues intersex people face and how we can improve health outcomes for us, and also to shift agency, which has so often been taken away from intersex people, back to the intersex person.
Great, thanks so much for that, Steph. Olivia, I'm keen to go over to you now. Why do you think it's important to engage young people in this research?
Well, I think, sorry, can you hear me all right?
Yep.
Okay, well, I think when it comes to importance in engaging young people in research, particularly people of diverse characteristics, I see a big importance in the fact that often we're not given a voice, and often we're left without the opportunity to not necessarily speak out, but actually be represented in studies, in statistics, things like that. And so actually being given the opportunity to take part in research and all this kind of stuff is hugely important, and not just helping to validate us, but also in helping to push forward by you know, getting data and such that can help with you know, pushing forward rights and such.
Thanks, Olivia. Rachel, you're a paediatrician. What do you have to say on this matter?
Thanks, Mon. Well, from the perspective of a researcher in the field and paediatrician, I think it's important first because young people who identify as LGBTIQ+ comprise a much larger proportion of the population than perhaps most researchers would expect. And that proportion can't be overlooked and shouldn't be overlooked. So more young people are identifying as sexuality and gender diverse than previous decades. And it's more so in the younger than older generations. What we know from the published data is that around 2% of young people identify as gender diverse and 5 to 15% as sexuality diverse. We did a survey not long ago of young people aged 14 to 25, where we were actually asking about COVID-19 vaccination intentions and acceptance, not anything to do with sexuality and gender. And of 16,000 young people, we found that 2.5% of them identified as trans and 14% as sexuality diverse, so not insignificant. Unfortunately, there's almost no population data on young people with variations in sex characteristics, and we need to address that. But second, we also know that there's huge disparities in health and wellbeing amongst the LGBTIQ+ young people compared to cisgender heterosexual young people. They have worse mental health, worse sexual and reproductive health, high rates of drug and alcohol use, and they're more likely to be disengaged from school and family and to be homeless and to experience violence and harassment. And then to experience barriers accessing health services, such as difficulties finding services that are safe and staff that are affirmative and knowledgeable and skilled in their healthcare needs. In that survey I mentioned, we did find that sexuality and gender diverse young people had much higher levels of psychosocial distress than the rest of the sample. And it's likely that young people who are intersex also experience similar health and wellbeing challenges. So Lastly, we need to capture data on sexuality, gender diversity and variations in sex characteristics in population surveys, because nearly all the data that exists that we have collected are in targeted online surveys focused on recruiting this population. So they're not necessarily representative, and it's really important that we do get population level data because that helps us to understand the relative health and wellbeing needs. So as a result of this absence of data, most of the health policies and programs for children and adolescents in Australia are not inclusive of LGBTIQ plus young people, and this really needs to change. Thanks.
Sure does. Thank you, Rachel. Kristen, you're a researcher in the area of child and adolescent health and particular expertise in sexuality and gender diversity. What's your take on this?
Great question, Mon. Thanks so much. It's really great to be coming from Gadigal land tonight and to be learning from all my fabulous panelists here. So I think that young people with diverse gender sexualities and variations of sex characteristics need to be included in research and consultation from the beginning of a study. So that includes defining the research question or questions to disseminating the findings. So sending out the findings, and that might be via publication or webinars like this or other kinds of brochures and pamphlets. And I think it's really helpful to use an integrated knowledge translation approach. So that's a model of research co-production where researchers partner with knowledge users. So in this case, that would be young people throughout the research process, and that ensures that all key stakeholders have input into a project. So I'm very passionate about that. This approach provides, I think, greater accuracy in research design and implementation, and it encourages really good uptake of research findings and recommendations to inform policy or practice. So that's the purpose for using this kind of methodology. And IKT approaches are used to improve the relevance and impact of research, particularly when it's translated to inform policy and practice. And I really like this approach because it centres young people's voices and it helps to facilitate meaningful participation rather than tokenistic participation. And it supports young people's autonomy and their self-determination, which is really important. Young people with lived experience and expertise must be centred in research about them. And as the saying goes, nothing about us without us. So I'm really excited that this webinar has been initiated and led by LGBTQIA plus young people and their allies, and that I'm invited guest. Thanks for having me.
Great points. Thanks so much, Kristen. And just a reminder to all our audience as well, if you do have a question for the panelists, feel free to pop it in the Q&A on your screen. Jessie, I might hand back to you for the next question.
Amazing. So the next question we have are, what are the barriers to engagement of young people with diverse genders, sexualities and variations of sex characteristics in research and consultation? I might start with you, Olivia. What are your opinions on that?
Well, as a trans woman myself, I can say that there are a lot of barriers that exist, but I'm mainly going to focus on the barrier of fear in actually going out and engaging. So basically it's, of course, there's a fear of being mistreated and discriminated against, there's this, some of us, there's a fear of violence, but one of the big fears I find with engaging in things like research and also things like the medical field is having to go over my story again and having to bring up sort of things that can be quite traumatic, things like dead names, having to go over medical history, stuff like that can be quite hard. And this is often worsened by having to do it face-to-face with someone. So I do see this barrier as being something that can be helped in a large way, and just thinking about how you can actually abstract these processes, putting, if you have to, putting things like dead name, if you're trans, that kind of stuff within forms, things that are less direct can really help into reducing a sense of fear when actually opening up to someone. And so that's what I see as a big barrier, sort of mental barrier per se.
Thanks, Olivia, for that. That was really informative, actually. So, Hib, what do you think?
Thanks, Jessie. I just thought I'd speak from an ally's perspective, and I thought I'd share a story just to connect to the question. So I've been involved in participatory research in the past, where I had to be on a Zoom call and answer a few questions with the researcher. I was introduced to one of the colleagues, and the researcher mentioned that this is Sahib, and she is from South Australia. One thing I noticed is that prior to this Zoom call, I hadn't been asked to disclose my pronouns, and nor did I mention them in any email conversations we had. For this case personally, this was not offensive since my pronouns are she or her. However, this approach could make other young people feel uncomfortable in engaging in research because they feel like they're not heard or they have not been respected. As an ally of the LGBTQIA+ community, I think that all practitioners and researchers need to communicate in a manner that welcomes all young people with all types of gender, sexualities, and variations of sex characteristics. This avoids making assumptions of someone's gender or sexuality, and it also involves taking active steps to respect their privacy. I think that recognizing someone's preferences for disclosure whilst being respectful is also a crucial step that needs to be taken. And this also means that the researcher or the practitioner should understand that not all young people will be 100% comfortable to disclose their gender or sexuality yet.
Thank you, Sahib. Emily, what about you?
Hi, I'm also on unceded Kaurna land, and when we're sort of approaching and engaging young people, diverse genders, sexualities, and variations of sex characteristics, we have to think through the different interlocking identities people have and their individual lived experience. So this sort of means like using a lens that recognizes those multiple social identities that shape us as humans. So things such as race, class, income, age, ability, gender, sexuality, and the variations of sex characteristics and the ways that they often overlap and then meet at an intersection. So if research and consultation doesn't think through this, it privileges certain bodies and it's not actually a true reflection of society. So young people also face additional barriers in research and consultation when they feel like they are not being heard and that the language used is often not approachable or easy to understand. So people feel like they're a statistic. They're just another point in the data collection process, a box to be ticked. But we're not statistics. And when we use these binary categories in collecting data, we sort of dehumanize that process and we sort of take away the focus of what it's meant to be about.
Excellent. Thanks, Emily, and thanks to you folks for those insightful answers. I'm just noticing a few questions coming through on the Q&A, and I think this top one from Philippa from Western Sydney University sort of leads into what I was going to ask next. Philippa asks, what are the key things that researchers should stop doing and what should they start doing to ensure research and the services and policies they inform improve all young people's health and don't do any harm, which ties into what I was going to ask, which what should researchers do to ensure respectful, safe and ethical engagement of young people of diverse genders, sexualities and variations of sex characteristics. Olivia, would you mind having a crack at that first off?
Sure. Well, saying this is less of a not and more of just a should do. And in general, I think really you should be going in prepared to learn and prepared to ask questions and change your assumptions. It can be easy to get, I wouldn't say false, but misleading of ideas about people of diverse characteristics, particularly I see this coming from a trans perspective. There are a lot of misconceptions that are quite popular about trans people. So I think when going into engagement with diverse youth is to keep an open mind and be prepared to ask questions. Of course, questions appropriate to the circumstances, but I think just let the persons speak for themselves to an extent. I think if you just, if they feel like they're being heard, and if they feel like their voice has weight, even mistakes, things like misgendering, that kind of stuff, they can tell that there's an effort or a conscious desire to have a smooth and engaging interaction, I think that it shouldn't be a problem, even in the event of these small mistakes.
Thanks for that, Olivia, and thanks also to the additional questions that are coming through. We're going to come to those in a little bit, but before we do, I might go over to you, Emily. What should researchers do when engaging with diverse youth?
Thanks, Mon. When researchers are looking at engaging in that sort of safe and ethical research with young people, it's having that personal commitment to reculturing research and working on co-design by enshrining young people's voices into the processes. So there's often power imbalances between the researchers and young people. And when we're speaking to those sort of safe and respectful engagement, we have to work through what that sort of means and looks like, because we know each person's experience is going to be different. And the process of data collection in itself can traumatize a lot of young people if we're bringing up things like dead names. And we're having to battle those sort of legalities as well. So that language used to collect data specifically for gender, it's important to ask what the benefits of this, what's the benefits of this, and whose point of view are we trying to support in this process? So is it to set up and support young non-binary and trans people, or does it reflect some more conservative views that favors things like profits over people? So when data is often collected, we know there's a purpose and an outcome desired from the researcher. Often it may be for things like large-scale policy changes. However, if we speak to the colonized language whose voices are echoed, distilled, and captured, the politicalization of lived experience in research reinforces and sort of contributes to heteronormativity, hierarchies, social norms, and those systems of oppression. So we sort of need to look at ways to reimagine that.
Thanks, Emily. Steph, what's your take on this?
Thanks, Mon. Again, I'll focus it on intersex people, but of course the principles are kind of more broadly applicable. Research really has to be trauma informed, and researchers need to be aware that research on young intersex people often involves the need for disclosure about their variation and medical histories. And for many young intersex people, that can be a history of medical trauma. And that repeated disclosure of such information can be incredibly demanding, to say the least. And relatedly, researchers need to offer support for young intersex people involved in research and consultation. But I think it's also really important that researchers bear in mind that there aren't that many people working in intersex peer or psychological support spaces, and often they are not paid to do this work either. So a lot more needs to be done holistically to invest in supporting intersex peer support groups so they can continue to do that work, especially if you're going to rely on them to do the heavy lifting after you've done your consultation or taken your data from intersex people. And a final point I'll raise is that it's really important to be clear with your participants what your hoped research outcomes are, like what is the data intended to be used for, so that young intersex participants can make an informed choice about their involvement. I think there's a general skepticism by intersex people about research. Research undertaken in a medical context is often focused on treatment outcomes, which tend to impose heteronormative frameworks on what treatment success looks like, and often doesn't consider the psychological or social impacts, as I mentioned earlier. While research that's undertaken in legal and social contexts often conflates intersex with LGBT, and therefore often misrepresents what intersex is and the issues intersex people face. So where research outcomes aren't directed at improving outcomes for the intersex community, it's difficult to engage young intersex participants.
Thanks, Steph. It's really awesome to have your insights in this conversation today. So thank you. Sahib, what would you like researchers to do?
I think one of the things we all want researchers to do is to build their knowledge. Like Olivia previously said, they need to be prepared to learn and build their knowledge. So education on LGBTQIA+ terms, gender identities, and variations of sex characteristics is the first step to ensure that researchers can break past the current barriers and make all young people feel respected and heard while participating in their research. So this could be in the form of online workshops or trainings to ensure that all medical practitioners, researchers, and organizations create an inclusive environment with embedded practices, such as using inclusive language when corresponding to all types of people, even if they haven't disclosed their gender, sexuality, or variations of sex characteristics.
Totally, thank you. Kristen and Rachel, you're both leading researchers in this field, so I'm very keen for your take on it. What should researchers do to ensure respectful, safe, and ethical engagement of diverse young people? Let's go to you first, Rachel.
Thanks. I think that when we're thinking about survey research, so regardless of what its objective is, and if it doesn't clearly even articulate that the intention is to improve the health and well-being of this group of LGBTQIA+ young people, I still think that all population health research needs to capture gender, sexuality, and variations of sex characteristics accurately. And it needs to be standard in all of the surveys that we do, because unfortunately it hasn't been. So I'm reinforcing what I said before. But where confidential self-reporting is possible, so down to whatever age that is, researchers should use the ABS standard questions about gender, sexuality, and variations of sex characteristics to collect this data. We know these questions have been developed with input from the community and been tested. So regardless of the age of the survey respondent, these are fundamental human characteristics critical to a person's health. They're the same as, they're the same as a person's age, sex presumed at birth, ethnicity, language, or Aboriginal and Torres Strait Islander status, geographic location of residence or ability. These are the same important key characteristics that define us. And so if we don't systematically collect it, we miss opportunities to identify those critical health inequities, and that's not ethical. So, and also adolescents who are LGBTIQ+ have an equal right to the highest attainable standard of physical and mental health, the same as other adolescents. And in order to facilitate this, we must design our research, I think, to include LGBTIQ+ adolescents, all the research that we do. And I think that you've heard tonight, echoed a number of times, that in order to do that, we really need to work with young people right from the beginning to the end. We also need to have LGBTIQ+ researchers on our research team to help us inform our research. So I think those are the key things that I'd like to say.
Thanks, Rachel. Kristen, what do you think researchers should consider?
Oh, thanks so much, Mon. It's just great to hear everyone's responses to these really important questions. So I thought I'd speak briefly about a couple of structural barriers, and by that I mean ethics committees and data collection tools. So I'll go to ethics committees first. I've got some very strong, passionate ideas about this, so I'll try and restrain myself. So generally ethics committees need upskilling about research in this area, and sometimes studies are approved that shouldn't be, because they've not engaged in appropriate consultation with people, including young people with diverse genders, sexualities, or variations of sex characteristics, depending on whatever the focus of the research is. And this research can harm these communities and their families and negatively impact policy and practice. So I guess that's my first point. And alternatively, ethics committees can sometimes misunderstand carefully designed research that has been co-produced for these communities due to a lack of education, misinformation or disinformation. So there's a bit of a double movement going on there with ethics committees. Young people's expertise and capacity is often dismissed or not acknowledged because of ageism as well. So ethics committees may consider research in this area to be high risk because it's sensitive, and the nature of the research might be misunderstood. And this can happen when people with lived experience and expertise are not on ethics committees. And it can also occur when people's identities or experiences are unnecessarily politicised, which is most recently evident with trans young people, as Olivia has flagged earlier tonight. So it can be difficult for young people who may require parental or guardian consent to participate in research on these topic areas also. And some young people might not have invited their families to learn about their gender or sexuality in particular because of fear of rejection or, they might perceive that their wellbeing and safety might be at risk. So that's ethics committees. And I'm just going to take a little bit of liberty here and move on to data collection tools. I know that Rachel has touched on this. So a few years ago, some of you'll know that I advocated for a human rights-based approach to data collection for people of diverse SOGI in particular, but of course I'd extend that to intersex people. And indeed, Steph has done some amazing work on the international stage in this area. So I advocated for questions about sexual orientation and gender identity in particular in the Australian 2021 census. And as Rachel has been speaking about, population-based data surveys and all administrative data sets, and that includes health services data. And I advocated for support in Australia for developing standardised indicators to collect this data, and in particular so that we could develop health interventions to support all people in these groups, but particularly young people, because that's the area that I work in. And I argued that these indicators must be carefully devised and not inadvertently invalidate the experiences of people with intersex variations or trans people. And I highlighted the importance of these population groups participating in data collection, which is why I flagged that IKT approach earlier on, analysis, disaggregation. So that's what Steph was talking about in terms of not putting all of those categories, the L, the G, the BTIQA plus together. They need to be separated out because they have distinct needs. And also self-identification, transparency, privacy and accountability. And of course, colleagues across the NGO sector have done really amazing work in this area and continue to do that. So we now have a 2020 standard for sex, gender variations of sex characteristics and sexual orientation variables, which Rachel flagged earlier on. And researchers can use that tool to collect the data. However, this tool was not used in the 2021 census, and you might have noticed an outcry in the last week regarding inaccurate data collection in the 2021 census because the non-binary option in a question about a person's sex conflated people who are transgender and intersex as well as those who are non-binary. And nor was sexuality diversity appropriately captured on that census. And remember, I was speaking about how that kind of data collection can actually do harm to these communities. And I would suggest that is what has happened here. So I'd like to see that change before the next census. But I think because I feel like we're an amazing group here, we should be using that straight away in all our research. And young people from these communities deserve to be asked meaningful questions that result in respectful data collection to inform health policy and service provision that best serves their needs. I'll get off my soapbox now. Thanks, Mom.
Not a soapbox. That was really, really important. And thanks for highlighting why it is so important for accurate data collection on our diverse communities, because we definitely don't have it with the census, and that definitely needs to change. So thank you for highlighting that. And also thank you for teaching me another new acronym, the SOGI. So the sexual orientation.
Yeah, SOGI and SOGI-esque that I'm sure Steph could speak to as well. So I've done a lot of work around SOGI in particular, and I've worked alongside my amazing intersex advocates such as Steph, who's done amazing work as well. So SOGI-esque, yeah, slightly different acronym in these spaces. So thanks, Mon.
Good one, thank you. I reckon we should move on to some of our Q&A questions. What do you think, Jessie? should we get into it?
Yeah, I think that's a really good idea. So if anybody does have questions, please feel free to add them. But I may go to the first one here. It says, does anyone on the panel have any suggestions for engaging young LGBTIQA plus people when systems, teams and individuals are not reaffirming of the research process?
So Safina, you're keen to have a crack at this one?
Yes. Well, when it comes to suggestions for engaging young LGBTQIA plus people when they're not reaffirming of this research process, I think the most important thing is really starting off with a mindset of realizing that they're not including these things, you know, keeping an open eye, like attending webinars such as this to really engage with young people when it comes to what kind of things that they're missing, because you can't really rectify or do anything when you don't know what the issue is. So the most initial really important thing would be to do so. But, you know, I'm happy to have anyone else contribute to this as well.
Thank you for that. Would anyone else like to weigh in on that question? No, we're all good. All right, I'll move on to the next one. And again, if you do
I'll say something. Yeah. So
please do. Thanks, Rachel.
Yeah, I think, I mean, in my experience in research in paediatrics, I think that a lot of my colleagues over time have been reluctant to ask the questions because, I mean, similar to what Kristen has said, that they're concerned about backlash and parents' concern, and also not getting it through the ethics approval process. So firstly, I think that it's an issue if parents, you know, if parents are made, you know, can be aware of what their young person's sexuality, gender or intersex status might be. So, and they need to be protected from that. But I do think also as a general rule, in addition to educating our ethics committees, we need to educate our co-researchers about the importance of asking, you know, these questions, and that, you know, this is not an area that should be considered as sensitive, or if it is, the appropriate processes need to be put in place to protect young people, as well as ensuring that their voice is heard. So, yeah, so I think that, you know, we can only do that if we have representation from the LGBTIQ plus community on ethics committees and within research teams. And I know that in New South Wales Health, we have the new LGBTIQ plus health strategy, and one of the objectives is to upskill the health workforce, which is a huge task, actually, I've got to say. Plus, but is going to ultimately cover off on a number of the things that we raised today. But I think that it's like an additional area of frontier, I suppose, is the younger age group. And that's the age group that I'm most interested in, and that I'm most concerned about supporting is adolescents, young adolescents who I see in a clinical setting. We need to make sure that we, you know, capture their experiences and their identity.
Thanks, Rachel. So more education, better representation. I'll ask the next question, shall I, from the audience? How do the young people on the panel feel about research being undertaken on these topics by a researcher who is not part of the LGBTQIA+ community, or a research team group that doesn't include anyone from the LGBTQIA+ community on their team? Yeah, so how do you feel when the researcher is not part of the community? Olivia, you've got your hand up.
Well, I mean, this can be a bit of a sort of, I guess, divisive topic in the community. Personally, the way I see it is I see it's fine in principle, and especially considering that, you know, as coming from a trans perspective, non-trans voices are definitely more dominant in society. So I do think it's perfectly fine to be researching these things without that voice. You know, without a trans person or diverse person, you know, performing the research. However, I do think there's still the onus to actually make sure you're going about it right, because without that direct input, you can inadvertently cause mistakes in terms of things like how you actually treat people in the research, and inadvertently you could cause harm. So I think if you don't have direct input on the team, is to at least consult a little bit with an outside group. I mean, actually coming to this webinar is sort of part of that. But otherwise, I think on principle, it's completely fine to be outside of these groups, yet still perform research on members of it.
Thanks, Olivia. Kristen.
Sorry, I know this question's not for me because I'm not a young person, but I've got quite strong views about it. So I actually think that where possible, that research about these communities should be led by people with lived experience. And if they can't be led, then these people should be co-researchers, or there should be appropriate mechanisms set up as part of the research. You know, there should be the research should be co-produced alongside people with lived experience. And I guess I've been around a long time, so I've seen research where people are really well-meaning. However, you know, unfortunately, the research design or implementation has not been ideal, and it can actually harm people from these communities. So I would strongly advocate for researchers to, for research to be led by people with lived experience. And if not, there should be people who are co-researchers on the team. And I feel that young people should be co-researchers on the team rather than just research participants as well. So I think I see that as best practice, or at least building in mechanisms to include people with lived experience, including young people, in the research design process. Thanks.
Unmute. Thank you for that. Would anyone else like to share their views on that topic about having LGBTQIA+ representation? Emily.
I think just now echoing a lot of what Christian just said as well, like it's all about having lived experience. And enshrining a lot of these voices into the process at the start, like it has a lot more impact as well. And you have that lived experience, and you have that, you understand the community that you're sort of researching and representing. And that's really important, especially if we're looking at some of these sort of things to do with LGBTIQ. And then not putting them all together into that same sort of category. Because as we've spoken to earlier in the night, we sort of say sometimes that stuff gets all lumped together. But if we have a lot more involvement from the community in of itself, and they're actually co-designed, or they are the lead researchers, maybe some of those sort of situations might not occur again, because they can actually be in that room and they have that power to be like, actually, that's not what we as a community want to see going forward. This is how we should approach these conversations and have these discussions. These are safe mechanisms, or these are like ways to ensure that everyone's able to feel safe and comfortable in the entire process.
Thanks, Emily. Steph.
Thanks. Yeah, I don't know how to my hand. That's okay. You know, I completely echo all of that, and I think that you know, I'm immediately kind of skeptical when intersex people aren't the researchers or part of the research team, because so much research that's done that includes us as participants isn't actually very helpful. It's not really for us. And so I think it's really a matter of trust, and it's hard to trust the research team when it feels like there's no involvement from intersex people in it. And it's not to say it can't be overcome, but I think, you know, you really have to show that you actually understand who intersex people are and what our needs are before you start to engage, because otherwise we're just not going to engage much at all. And, you know, it leads me into a broader point of the acronym itself and how we talk about LGBTQIA+. You know, and it's really just a number of different communities. You know, we're not one community, so we're not all the same. I like to think of them as allies to each other, ideally. So many research projects talk about LGBTIQA+ people, but actually mostly it's not relevant for intersex people. So just be specific about who you want to research and what you're trying to achieve, because grouping us in is unhelpful for everyone. And I can't actually think of any LGBTI research that currently exists that is helpful for intersex people. And it's usually because the researchers misunderstand or make assumptions about what intersex is. And this impacts intersex participation rates as well. So often there's too few intersex participants for the data to be meaningful at all. So, you know, if you genuinely want to conduct research with intersex people, you're going to have to think hard about what language you use and the way you go about seeking research participants, because a general call out for LGBTIQ people isn't really going to find many intersex people. And I'd recommend spending a lot more time learning about the intersex community and different intersex variations, and reach out to intersex-led organisations. Or, you know, if you don't want to include intersex, or your data ends up not being representative or include statistically significant number of intersex people, then just don't include the I in your LGBTIQ data, because that only serves to further misrepresent the issues and the needs for intersex people.
They're such great points. Thanks so much, Steph. And I like the way you articulated the letters in the acronym. Like, it would be nice if we are allies of each other. We're all distinct, but it would be nice if we're all allies. So it's a lovely, hopeful, positive way to think about it. We're almost out of time this evening, but after hearing all of the insights today and hearing people's experiences, Jessie, I believe we have a call to action. Is that right?
Yeah, that's right. So our call to action is that all researchers must work with young people of the LGBTIQA+ community, and researchers with lived experience from study inception to the dissemination of the findings. I would like to take the time now just to thank everyone who has come along tonight. So thank you to the Y Commissioners, Safina for the poll, the panelists for your contributions, and the audience for attending. I'd also like to give a special thanks to our guests Stephanie Lum and Olivia Stewart for taking their time and their incredible insights. I want to give a special shout out to Betty Nigan for coordinating and organising the event, and all the commissioners who have called for better research to ensure health equity for our young LGBTQIA+ community. Also thanks to Dr. Newt Ogun, Maya Giordano, Associate Professor Pip Collin, and Dr. Sharon Medlow for their support for this event. Lastly, a big thank you to the Y Commission Pride Project team members, Safina, Ian, Sahib, Holly, Jackie, Sharanya, and Emily, who gave their effort, their time over the past 4 months to work tirelessly to plan and co-create this event with us. On behalf of the Wellbeing, Health and Youth Centre of Research Excellence and the Young and Resilient Research Centre, we wish you all a lovely night. Please feel free to email us at info@y.org.au. And could you please stay an extra couple of minutes to just give us some feedback about tonight's events? Thank you all.
Thank you. Well done, everyone.